but then I had this interruption, so now I've lost 7 seconds, but I'm okay with that. So let's keep going. This is a status post ACL reconstruction. She's a 30-year-old female, 10-day status post ACL reconstruction with the patella tendon graft. So that's one of the first things I want to know is how she had that reconstruction. Did they use patella tendon? Did they hamstring? Did they do something else like an allograft, something else, you know, that isn't part of her body. So we want to know that because the protocols are different, right? You guys learned that in class. Her pain level right now is very minimal, 2 to 3 out of 10, with full flexion of the knee and no pain at rest or with walking. So it's really just when she's bending that knee that she's getting pain. She's weight bearing is tolerated, and she has a single crutch, and she's wearing an ACL brace. She has difficulty going up and down stairs and is unable to drive at this time. She is currently not working and would like to be able to go back to playing softball and basketballs. So we don't know what she does for work. We know that she's an athlete and likes to play. Her objective finding is that she's 10 to 90 degrees, so I know she's lacking that 10 degrees I want her to get for walking. So that I'm thinking in my head, and I'm thinking she's only 10 days out. What can I do? Her 90 degrees of flexion, that's still not ideal, but it's more functional than the 10 degrees she's lacking in extension. So I'm going to focus probably more on the extension at least until I talk to her and see if that changes. Her quad recruitment is not very good. It's poor with a quad set, and she can't do a straight leg raise without a knee lag, so she's kind of doing this. So I want to work on that because that's also going to help. So she's not, that 10 degrees that she's lacking actively is probably more of a muscle strength. It doesn't tell me what she has passively, so that's something I'm going to probably measure and see if it's more of a strength deficit versus a joint deficit, or maybe a combination. Her hamstring strength is a 3- out of 5. Her left lower extremity is within normal limits. Her girth, I do look at that, and it looks like on this, you guys, where do you think she has most of her swelling? When you're looking at your scenario, anybody who has theirs. Yeah, mid-patella. So I could do girth measurements, right? I could do some soft tissue massage and then come back to that and remeasure that to see if that worked at all, and if that's going to, is the swelling going to affect their range of motion somewhat, right? Yeah, so depending on where that swelling, especially if it's back in the popliteal space, that's going to hurt when she bends her knee. So it could be a swelling that's causing that too for her. I'm thinking in my head, I wonder how strong her glute med is, just her hip muscles in general. The plan of care is to increase her lower extremity range of motion and strength as tolerated within her protocol. So I'm thinking, what kind of things? This is the max phase, correct? At 10 days post-op, patella tendon. So what is something I do not want to do with this person? Okay, hyperextension, or how about just even open chain extension? Am I supposed to do open chain extension at 10 days out? I don't think so, right? No. So I'm thinking that in my head. I know no active open chain. Knee extension from 40 to 0, right? I just want to avoid that short arc. This guy here, I'm not going to be doing that from 40 to 0 at all with them in their max phase. I also want to be careful in the closed chain. Do you guys remember where it is in the closed chain they're vulnerable? With the degree? 60 to 90, right? So I'm not doing this, am I? No. Okay, because I have to redo my practical. And then that poor patient tore their ACL maybe again, and they're not going to be happy, right? So more importantly, you just want to protect that patient. So I'm thinking I need to, in my head, when I'm pre-planning, okay, I'm thinking I want to get rid of some of that swelling. I want some range of motion with them. I'm going to avoid active short arc full extension with them. I could do patella Mohs with them if I feel like that's lacking some of their knee extension. So what direction would I go for patella? A superior, right? Yeah, I could do some. And if she's not having any pain, so I don't really need to be doing the grade 1s and 2s, right, for her patella, because at rest she's really not having any pain. So I'm going to be going in more to a grade 3 to kind of change that range of motion. I can do isometrics with her, right? Is that safe? And I can do some hip strengthening with her. All right? So that's what I'm thinking in my head, the things that I want to do and the things that I don't want to do with this patient. I can test their hamstrings or their glute med, depending on what I'm going to strengthen that day. I have towels. I have a bell in case I leave them. I have a tape measure in case I want to measure for their swelling. I have my goniometer in case I'm going to measure their range of motion as my Flexibility, I have some lotion in case I'm going to do STM, and I have towels, and I also have some alcohol. Okay, so that is my 20 minutes I'm at now. So I used 5 minutes of pre-planning to kind of think about what I wanted to do and how I wanted to do it. Okay, so then my patient is probably sitting here. She's, I guess you may still have her brace on. She has a crutch. It is, you're right. So let's grab her one of the shorter crutches over there, guys.